for Lorna to switch us on. Lorna says we're switched on, so we'll start. It is 2 o'clock. Welcome to Cabinet, 20th of October, 2 o'clock. As usual, this is broadcast live via the website and archived so you can view it later. As you know, this is going out remotely. You guys are joining in. So to start with, I better do a roll call to make sure everyone is here and can see and be seen. So I'll start off with you, Rich.
Yeah, Richard Blunt, I'm here.
Lee?
Yeah, here.
Blake?
I'm here.
Trevor?
Yes, I'm here.
Byron?
Yes, I'm here.
Louise?
Yes, I'm here.
Richard?
Yes, I'm here.
And Deborah?
Hi, I'm here.
Great. Okay, so usual rules. When you want to speak, use the raise hand button so I can see you. Turn your microphone on when you're starting to speak and switch it off when you finish so we don't get feedback. At the end of each debate on each report, please turn your microphones on. If there doesn't appear to any dissent, I will just ask you if you agree with the recommendations to save another lengthy roll call each time. So if you do disagree with something, please say, and then we can take things to a vote. Okay, thank you. Apologies for absence, we've got none. So the first item is minutes on pages 3 to 12. I move that the minutes of the meeting held on the 18th September 2020 are taken as read, confirmed and signed, subject to the following addition to minute 430. That Richard Shepherd declared a personal interest in item 7, community managed libraries, as his wife works in a community library. I'll move it. Can you second, Blake?
I'll second them, Leader.
All happy? No dissenters? Very good, thank you. Urgent items is agenda item 2, and I have none. Agenda item 3 is declarations of interest. I think I've got something from you, Richard Shepherd.
Thank you, Chairman. Yes, I think I should declare a personal interest as I'm a member of the local pension board in the item concerning the exit payments. I think it's item 9 from memory. I hope that's right. If it's wrong, somebody correct me, please.
No, that's correct, Richard. So you declare a personal interest, but you can still vote.
Indeed. Thank you, Chairman.
Thank
yes.
You. Right, let's move on then to agenda item 4, coronavirus impact and response of the County Council recovery, pages 13 and 14, and the supplementary report, pages 3 to 24. This report follows what we've had at previous cabinet meetings about the work we've been doing along with partner organisations to address the impact of the pandemic and details the ongoing impact of the pandemic, the emerging risks over the winter and our recovery planning, both in terms of services and the economy. The latest detail is set out in the supplementary report, which was published on our website and circulated to members on Friday. So today we've got with us the Assistant Chief Executive, Tom Pennell, along with the Director of Public Health, Mike Sands, and the Head of the Transformation, Chris Lewis, who will present the report. I'll then go to Lee Brecken first to speak as our Cabinet lead. So I would presume that, Tom, you're kicking off, are you?
Yes, that's right, Leader. Yes, as you said, this is the latest of a series of reports updating Cabinet on COVID-19. And in presenting this, myself and colleagues will focus on the supplementary reports. I'm going to summarise the section on the LRF and County Council governance and activity, which is at the start of the paper, and also the section on enforcement powers, which is towards the end of the report. And then I'll hand over to Mike and Chris to cover other aspects. Paragraphs 7 to 11 summarise the broad strategic approach to addressing the pandemic, which is being taken by the Local Resilience Forum and the County Council. I think it's fair to say that not detailed in those paragraphs is that there's a rich structure of partnership groups addressing a wide range of issues relating to the pandemic, whether that's communications issues, health issues, the economic impact, and a whole host of other things. I think perhaps the most...
Tom, can you just hold 1 minute? Can I ask everyone, is Tom in the room here? We can't see Tom speaking. I can see Tom perfectly clearly on my laptop. Can everybody else see Tom speaking on their laptops?
Yes.
Yeah, I just wanted to make sure that if we have any members of the public watching us, Tom, they can see you. I will presume they can, and it's an anomaly here. So carry on, Tom.
Okay, thank you. Perhaps the most important thing to note from those paragraphs is that the LRF Strategic Coordinating Group and the Council's Crisis Management Group are continuing to meet regularly, and their current focus is very much on COVID-19, but those groups will also, over the winter period, be leading the response to other issues, including the end of the EU exit transition period and any other, for example, winter weather-related emergencies that might happen during that period, so that we can cover all of those issues in the round. If I can jump ahead to paragraph 34, which is where the section on enforcement powers start. This summarises the new powers given to the Council in July, known as the number 3 regulations, which enable the Council to give directions which can impose prohibitions, requirements or restrictions in relation to premises, events and public outdoor places. And the report sets out the details of those powers, the grounds for making a direction, procedural requirements, the enforcement powers, and also the County Council's approach to those. With respect to the latter, the County Council's approach, if I can refer you to paragraph 45, which notes that the delegated authority of the head of regulatory services has been amended to enable him to exercise the power to issue directions, and also that environmental health officers at district councils can be designated to assist with enforcement activity as well. And paragraph 47 does detail 3 cases where enforcement action has been taken to date. These additional responsibilities have had resource implications for the council, in particular for the regulatory services and legal sections, and those are set out in paragraphs 49 to 52. You can see in that paragraph that additional pressures have been placed on staff who have worked overtime, and also agency staff have been brought in to help address those pressures. So just worth being aware of those resource implications. At that point, I'll hand over to Mike to cover the health aspects.
If we haven't got Mike ready straight away, are you there, Mike? Okay, well, he's not there at the moment. Let's go to Chris Lewis, because he's definitely there. You go next, Chris.
Thank you, Leader. Good afternoon, everyone. The recovery sections of this supplementary paper, starting at paragraph 7, page 7, give an initial reminder of the nature of our recovery work, the overlap with the ongoing response, and of course the high-level approach contained within our recovery strategy. The strategy itself has acted as a useful guide in supporting the planning of our functions and services as they continue to deliver during the pandemic. And the sections of the report on page 7, 8 and 9 refer specifically to our progress on infrastructure and economic recovery themes. You'll recall that a series of short-term interim plans were developed for all function services of the County Council to ensure primarily that service provision would continue, or in a number of cases actually restart. We'd ensure that new service requirements and pressures were understood, and arrangements put in place to deal with national and local guidance on areas such as social distancing, furlough arrangements, and support for those staff working from home. Paragraphs 24 to 28 provide a bit more detail on our recovery work. The member working group on recovery has now met twice to contribute to the development of the strategy, and also then to receive some more detail through departmental position statements, which were received at the end of July. Given the ongoing nature of the pandemic and our continuing response to it, managers across the council have now been asked to review those delivery plans and extend them to the end of March 21. Guidance to support them in the planning has been updated and is included at Appendix B to the report, with corporate services prioritising support to that process. The second round of planning has just concluded, and the working group will now reconvene to receive new position statements and subsequently bring that report back through to Cabinet. One of our areas of particular emphasis, as referenced in paragraph 26, is the ongoing support to staff who continue to work from home, and the subsequent arrangements that we've provided for them around well-being, and of course other areas such as building compliance and technology work. These have all been important in securing continuing productivity and ongoing service performance. That work is now continuing to help define how those arrangements will continue, including the use of our county council estate and how that will continue into the long term. Paragraphs 29 to 33 refer specifically to the work of the Economic Recovery Group led by Simon Lawrence, who continues to develop our approach within the LRF's Economic Recovery Cell. The initial paragraphs here focus on the considerable impact the pandemic has had on the local economy and, of course, the concerns of local business. The subsequent paragraphs then go on to highlight the work that we've undertaken to support the economy, including the launch of the Business Recovery Grant, which has already seen £400,000 of the fund allocated across Leicestershire businesses, with more applications anticipated, particularly as businesses come to the end of receiving benefits through the existing furlough scheme. Other support measures are highlighted in paragraph 32, including support to the government's Kickstart programme, extensions to our existing superfast broadband programme, and how we can align economic recovery with the principles of the environment strategy and, of course, carbon reduction commitments. That concludes that section. I think if Mike Sands is available, I can hand back to him. Thank you.
I think, Chris, we think Mike Sands might have severe internet problems. And let me just call him, see if he can answer. Are you there, Mike? No, well, you just carry on, Chris. And then if Mike does get back on, we'll ask him if he wants to update us later.
Thank you, Leader. No,
We'll just take what we can take with you two guys and then revert back to Mike on his bit. So you just finish up, Chris.
Yeah, that concludes our sections on recovery and Tom's section around enforcement. So I think we can move to the items in the order paper as they are. Thank you.
Okay, I'll just take some advice from the Chief about what he wants us to take in the absence of Mike. Chief.
Mike's section is paragraphs 12 to 20, effectively. I would suggest you take those as read in the circumstances. If there are questions which members have which can't be answered, we'll deal with them later.
Okay, over to you then, Lee. So you can be Mike as well and move the recommendations if you see fit.
Okay, thank you, Leader. Mike's sections are in the report, so hopefully please take them as read. Can I thank Tom and Chris for the report? The report outlines the works being done by the County Council and also the partners at the Local Resilience Forum. It gives full update on our health, the response, the recovery in both infrastructure and the economy, and also the update around enforcement, which highlights the pressures the small team are working to, but still delivering an exceptional service. And we thank the team for the over and above work that they have done to date alongside with their agency colleagues. You are making a difference and you're helping to keep us safe. Thanks to all the officers for this full report, and I would like to move 4 recommendations to note as listed on page 3 of the supplementary report in the papers. Thank you.
I will second them, Lee, for you, and just say to members, if you did have specific questions for Mike, just email them in and we'll get them back to you. So I can't see anybody indicating that they want to speak. So if we take it that it's been moved by Lee, seconded by me, are we all in favour? Yeah. Okay, thank you. Let's just move on then. So we're now going to agenda item 5, Adult Social Care Winter Plan and Measures to Support Care Home Provider Sustainability. This is on pages 15 to 42. The report concerns a requirement to produce a winter plan for adult social care by Halloween, as it happens, and set how the council will support adult social care providers in Leicestershire in the context of the ongoing pandemic. The report also details the support already given by the council to providers of care during the pandemic and identifies ways in which the council is managing the risk to the future sustainability of the care market. We've got John Wilson, who's going to speak first, the Director of Adults and Communities, and then I'll call Richard Blunt, who's the Cabinet Lead Member for this item. So hopefully you're there, John.
Yes, hello, good afternoon. Thank you. I'm hoping there's no significance of the winter plan and Halloween, but we'll see. So the government produced the winter plan on the 18th of September with a requirement that all local authorities sign a letter submitted to the Department of Health and Social Care to say that a local winter plan would be in place to cover the period through from October through to March of next year. The national plan sets out a number of key elements of national support together with requirements on local authorities, NHS organisations and other social care providers locally. Paragraph 23 of today's report outlines the government's support offer in relation to the national plan, and it also, alongside the national offer, there are 75 requirements and actions on local authorities. And those actions are in the areas of preventing and controlling the spread of infection, ensuring that there's collaboration across health and care services, support for people who receive services, carers and the workforce, and support to the wider system. The Leicestershire Winter Plan is currently in preparation, ready for submission by the 31st of October. Appendix A to this report sets out some of the required actions and gives a flavour of the responses of the County Council to those actions. Paragraph 27 of today's report outlines the timeline for completion, which includes engagement with and an invitation to health partners, sector representatives, Health Watch and the Overview and Scrutiny Committee of the Council to comment on the draft plan. And then the final document will be signed off and approved by the Chief Executive, myself, following consultation with the Cabinet lead member. The majority of actions required, although there are 75 actions, the majority of those are either already in situ or are in hand. But there are 3 or 4 areas that are of more significance. The first is the provision of free PPE, the extension of the Infection Control Fund, a requirement for a market sustainability review, and a requirement to identify designated care homes. I'll just comment on the first 2 of those, and then I'll hand over to a colleague, Sandy McMillan, to comment on the other 2. In terms of the free PPE, for any provider that's regulated and registered with the Care Quality Commission, the government have a portal, PPE portal, and providers can access PPE through that portal. Currently, that won't supply all of the requirements that providers have, but the intention is, and the government have made clear, that they will extend that provision over the course of winter to ensure that sufficient capacity is in place. For any provider that isn't regulated by the Care Quality Commission, providers such as day and community providers, or people who have a direct payment and employ their own PAs, for example, the PPE will be provided through the County Council via the LRF supplies. In terms of the extension to the Infection Control Fund, very welcome, £6.1 million for the Council between now and the end of March. That will be provided to residential providers and community-based providers, and it will include both council-funded service users and people who fund their own care. So across that winter period, we can expect that residential providers will have in the region of £660 paid to them, and community providers £330 per service user, which would be very welcome. Paragraphs 28 through to 36 also highlight the substantial support given to the social care sector by the council over the last 6 to 7 months. And that includes not just the current ICF, but also the previous round of Infection Control Fund, which was £6.7 million. But in addition to that, the council's also provided £3.5 million of funding to meet exceptional and additional costs of providers through that period, and a substantial amount of funding provided through repayable advance payments to providers to enable their cash flow throughout the whole period. I'll hand over now to Sandy to talk through the market sustainability review.
Thank you, Chair. Nationally, for some time, there's really been a lot of concern about the sustainability of care markets, and these risks around sustainability have clearly worsened as a result of COVID-19. And the Department of Health and Social Care has required that upper tier councils undertake a self-assessment of the risks of service continuity from now until March 2021, and the mitigations that we will put in place to manage those risks. And the council's self-assessment that John mentioned earlier has been submitted on that today, and a draft version of the headline elements of that is attached as Appendix B of the report that you have today. Now, the definitions used by the Department of Health and Social Care really do seem to rather downplay some of the degree of those risks. Just for example, to be somewhat concerned actually means to expect serious challenges which may compromise our ability to ensure continuity of care between now and the end of March 2021. To be extremely concerned, you have to think you're in that position now or will be in that position within the next few weeks. So what you've got in front of you is how we've assessed that, but very much assessing it within the framework given to us. I think if we'd been doing that locally, we'd been presenting a higher level of concern. And we certainly, if in terms of the definition I outlined previously of being somewhat concerned, there certainly are services in Leicestershire that do meet that level of concern, where there are concerns that there will be serious challenges in maintaining service continuity between now and the end of March. Section 1 of the assessment in Appendix B outlines the risk of reaching a crisis point between now and the end of March and the issues that are likely to lead to some sort of crisis. And all areas of the care market have some element of risk, but the highest risks in Leicestershire are in care homes for older people, home-based reablement, which is the in-house service provided by the council, and community life choices or day services. The longer-term risks around market sustainability are not contained within this assessment, but clearly there will be significant risks that will continue in the medium and long term in relation to care markets. This is not some issue that's going to suddenly go away in March. Section 2 of the assessment in Appendix B outlines the mitigations that we'll put in place for the council, and many of these mitigations are the actions which are contained within the winter plan that John has just outlined to you. But these will include the work we've done to engage with providers and improve our market intelligence and offer appropriate levels of enhanced support, including enhanced financial support. And those have been very welcomed by providers and clearly go some way towards mitigating those risks. And Section 3 outlines the confidence levels that we have in the likely impact of those mitigations. The greatest level of concern in terms of the mitigations is in relation to financial sustainability. And financial sustainability concerns can lead to a range of impacts on service quality, service availability, staff retention, and ultimately lead to the to provider failure, i.e. services going out of business or ceasing to be able to function. And Appendix C of the report outlines some potential options that the council has for intervening in the event of provider failure, and the range of options would include direct intervention by the council in terms of taking on services, right up to lower levels of intervention, which would be enhancements of what we do now in terms of using emergency support and relying on other providers to fill the gaps left by providers that fail. So just moving on from that to the fourth area that John outlined around the need to have designated settings for COVID patients being discharged from hospital. So this is purely in relation to people who are COVID positive, who are being discharged from a hospital bed into a care home. Department of Health and Social Care said that those people will now have to go to a designated setting. So previously, those people could be discharged to any care home. They could only be discharged to a care home that is a designated setting that's able to provide the kinds of infection control and isolation that are required to keep both that person and other people safe. So we're in the process now of discussing with providers who wish to become a designated setting, and that will include both providers who may wish to be that so that they can receive back their own residents in the event of those people being admitted to hospital, or the council actually looking to commission, along with our partners in the clinical commissioning groups, a dedicated resource which is able to take COVID positive people who are unable to go to another care home. And we're in the process of looking at providers who are interested in that, and with a view to selecting one that would provide that service across the health and care system in Leicester, Leicestershire and Rutland. And we'll clearly be progressing that as soon as possible, because we need to have that kind of dedicated facility available so that people will not be stuck in hospital and will be able to be discharged appropriately. So that's really finished what I wanted to cover. So I'm happy to take any questions, and I'm sure John is too, Chair.
Great. Over to you, Rich.
Thanks, Nick. Thank you also to John and Sandy for covering the item in such detail. I mean, I think it shows a lot of the complexity of it, and also massively the risks that we're facing. I mean, in simple terms, we have to have an agreed winter plan with the government, not least because without it, we can't unlock the funds we need to deliver the services that Sandy particularly has just outlined now. I mean, it's also crucial to have a plan in place as we go into the next phase of COVID-19, and we don't know what's going to be in front of us, but it isn't going to be easy. And in my mind, we're looking at where we're going to be in May next year, and we'll still be somewhere like we are now, I think. I'm pleased that it was supported by the Adults Community Scrutiny Committee, and with that I'm happy to move the recommendations 3, A, B and C on page 15 of the Cabinet Papers.
Thank you. Lee?
Yeah, thank you, Chair. All providers of adult social care and support have faced significant challenges during this emergency and have shown great resilience and dedication in keeping the people of Leicestershire safe. Well done to John, Sandy and the whole of the adult social care team and everyone involved, and I'm delighted to be asked to second the recommendations in the paper, Chair.
Good, and I'm happy. Are we all happy? Can we all type of indicate? Thank you very much. Thank you, John. Thank you, Mike. Sandy rather than Mike, got Mike on my brain. Okay, so the next agenda item is agenda item 6, Health and Air Quality Joint Action Plan 2020 to 2024, pages 43 to 74, sets out our ongoing work with partners to improve air quality across the county and seeks approval for the Leicestershire Air Quality and Health Joint Action Plan. I understand that Mike Sands is still not available to be with us, but luckily we have Kelly Marie Evans, who is a air quality consultant. So Kelly, can you help us out in Mike's absence?
Yeah, of course. Thank you, Chair. So, as I'm sure you're aware, air pollution has a significant impact on the public's health and well-being, and poor air quality is one of the largest environmental risks to public health in the UK. So this report is to update Cabinet on the Council's ongoing work with partners to improve air quality across the county and seek approval for the Leicestershire Air Quality and Health Joint Action Plan. It builds on the work that we did from the Joint Strategic Needs Assessment on air quality and health, and its vision is on paragraph 33, but that is to reduce the impact of air pollution on the environment, human health, and the contribution it makes to health inequalities. It was developed with partners across the county, and we've decided, we're proposing to concentrate on 3 areas to start with. They are again mentioned in paragraph 33. So looking at active and sustainable travel, planning design guides, linking with the work that the strategic planning group's doing, and ensuring that there's a consistent message across the county with regards to air pollution. It has been to the Scrutiny Commission, and the comments that they have made have been incorporated into the plan. And that was about most I was going to say, if anyone had any questions.
Thank you very much, Kelly. Air quality is exceedingly important to us all, because obviously we all have to breathe in the air. So can I go first of all to Lee?
Yeah, thank you, Chair. Air pollution does have a significant effect, and it affects all ages. The Air Quality Action Plan has 4 key aims: simply to reduce the impact, raise awareness, increase our understanding, and not only meet but exceed statutory obligations and targets on air quality. The plan has enjoyed thorough challenge and scrutiny, which started a year ago with the engagement workshop through to developing the plan and now presenting it to scrutiny before. The concerns that they raised regarding ownership and member involvement have been addressed, and they're clearly listed on page 39 of paragraphs 38 and also 39. As Chairman of the Health and Wellbeing Board, I will ensure that this is delivered through the Health and Wellbeing Board. Finally, on page 3 of the plan, page 53 in your packs, the lead member forward sets out the Council's commitment to air quality. In summing up, good air quality is essential for our health, quality of life and environment. Can I thank Kelly for her work on delivering the plan to us, and also to Mike Sands for his annual reports that have raised the issue of air quality time and time again. I'm pleased to move the 2 recommendations on page 43 of the agenda pack, and that this Cabinet approves the Leicestershire Air Quality and Health Action Plan 2020 to 2024. Thank you, Chair.
Great, thank you. Louise?
Yes, thank you. I'm really pleased to see this coming through, and I think it's really important to have a joint strategy across the whole of Leicestershire. So I'm very happy to second. Thank you.
Thank you, Louise. I've got Blake Payne next.
Yeah, thank you, Leader. Just with my lead member for climate change agenda hat on, can I just say how pleased I am to see this report and, of course, pledge my support towards it. The forward by Lee Brecken does touch upon the fact that air pollution and climate change are often said to be 2 sides of the same coin. Both are largely caused by the same sources and have similar solutions. And we declared a climate emergency in 2019, and this authority, Leicestershire County Council, have not only invested multi-millions of pounds into an ambitious agenda to get our carbon emissions down by 2030, and wider carbon emissions down by 2050. But a bit like the tree strategy, there's all these components that will come together to help us achieve that objective. So it's hugely important that not only we work together with all the stakeholders in Leicestershire to deal with air pollution, but by taking this joint approach, I'm feeling ever more confident that we'll meet our carbon reduction targets by 2030 and later by 2050. Thank you, Leader.
Very good. So it was moved by Lee and seconded by Louise. Can I just show a quick show of hands that we're all in favour? Thank you. Can I thank you, Kelly, for your presentation? Very good. It's nice to see someone from Mike Sands' department who's not actually Mike Sands. So if you want to come back again, you'll be more than welcome. Right, let's move on then to agenda item 7, development of a healthy weight strategy for Leicestershire, pages 75 to 104. This is also one of Mike's reports. He's not here, but luckily we have another person that works for Mike, Catherine Packham. Is it, Catherine? Do you want to go ahead and present, Catherine?
Thank you. Thanks, Leader. Yes, so I bring to you a draft of the healthy weight strategy for Leicestershire. 2/3 of adults in Leicestershire and about 1/3 of children are overweight or obese, and it's an important risk factor for a number of cancers, heart disease, diabetes, and also increases the risk of severe COVID-19 disease and increases risk of needing to be admitted to an intensive care bed for COVID. The draft healthy weight strategy, which is appended to the report in the pack, is presented for your agreement to go out to consultation. The consultation will include an easy read version of the strategy, and there will be online survey questions, which will also target groups highlighted in the equality impact assessment as being particularly affected by healthy weight issues. So, for instance, learning disability groups, Black, Asian, minority ethnic groups who are at increased risk of diabetes, and also weight management service users. And so we'll collect more in-depth interviews from these particular groups. And there will also be opportunities for this to be discussed by the Health Scrutiny Committee and the Health and Wellbeing Board later in November. So the draft strategy is presented as set out in the pack. And so the recommendations that we've set out in the covering report is that the draft healthy weight strategy to be agreed for consultation by yourselves, and also that a further report be brought to Cabinet in spring 2021, which would set out the outcome of the consultation and also to seek approval at that point for the revised draft strategy for the healthy weight. Thank you.
Catherine. Would this go to any schools at all? Because obviously children have a big influence on what their parents do and say.
Of course. So we're looking at a range of, as well as those target groups that were highlighted by the Equality Impact Assessment, we're also looking at a wider stakeholder group that would include school settings and other relevant organisations, for example, district councils, and also wider health services, provider trusts in the health economy, so a wide range of groups that would be involved in work with overweight and obese children and adults.
Thank you. Lee?
Thank you, Chair. This council has the statutory duty to take appropriate steps to improve the health of people living in Leicestershire, including supporting people in achieving a healthy weight. Mike Sand's annual report last year highlighted the issues that we had as a county, with over 61% of our adult population being overweight. This consultation will run for 2 months, and including the Health and Overview Scrutiny Committee and also the Health and Wellbeing Board. The economic burden figures are startling on page 77. £6.1 billion spent through the NHS, which should be being used elsewhere, and local authorities spending £350 million in social care support, again, could also provide so much more. Timetable is to bring the final draft strategy for approval to this cabinet in spring. Let's get this work done. Can I thank, obviously, Kath for presenting it, Liz Orton as lead consultant, and again, Mike for his work being done in this key field. And I'm happy to move the recommendations on page 75, Chair. Thank you.
Thank you, Lee. Deborah?
Thank you, Lee. I think the timing of this is really good after we've all gone through a summer of lockdown and probably not moved around as much as we normally do, and probably ate a bit more cake than we would normally. So really good time for this to come through. I think we've been highlighted all the health risks associated with being overweight and the knock-on effect that can have. So I'm very happy to second this.
Okay, moved by Lee, seconded by Deborah. All in favour? Thank you. And can I thank you as well, Catherine, for stepping up to the plate. Again, nice to see someone from Mike's department who isn't actually Mike. Moving on then, agenda item 8, Community Speed Watch Initiative, pages 105 to 120. This concerns our formal position on the establishment of a community speed watch initiative following the trial of average speed cameras across 7 locations across Leicestershire. Can we please note we've had comments from Janice, the member for Earl Shilton. These were attached to your order paper marked 8. We've got Ian Veers with us today. He's the Assistant Director of E&T. He'll present. Then I shall go to Trevor as our lead. So Ian, over to you.
Hello, Leader. Hope you can hear me there. As you said, the purpose of this report is to establish the County Council's formal position on the Community Speed Enforcement Initiative following the lengthy trial of average speed cameras at 7 locations across Leicestershire. The outcomes of the Community Speed Enforcement Initiative, often called Average Speed Camera Trial, have been extensive, and as per paragraphs 18, detailing how the sites were selected, we looked at various different sites, and the trial is detailed from paragraph 34 onwards. I wasn't intended to go into the detail of all of the data we've collected and so forth, but if there are any questions, happy to take them at the end. This data has been really worthwhile in collecting because it's helped us to look at the level of problems and will inform future site selections if approved today. As members are only too well aware, speeding traffic is of great concern to our communities and often is one of the largest issues that is raised with our department and the authority. And it is only the police that can enforce speed limits, something that's often forgotten. In June 2019, the police did introduce a community concern sites category for those areas that don't traditionally fit under the normal criteria for core mobile or static speed enforcement cameras for accident purposes. And our work with the average speed cameras will complement this as well. Broadly, a police community concern site is a site where 50% of all speeds are over the National Police and Crime Commissioner's threshold. This is the reason the police have this threshold is they need to target those resources where, unfortunately, the most speeding is impacting on communities the most, and we will look to adopt a similar criteria. Sites identified as community concern sites are visited at least once every 6 weeks. If the recommendations are approved today, we will develop all the necessary work to implement going forwards an ongoing programme of community speed enforcement initiatives with the police to support their work, as I said, including the introduction of 7 new average speed camera sites in line with the criteria we've set out in paragraph 56 onwards of this report. And it will be done in association and consultation with local communities and local representatives. It should be noted that the proposed criteria does mean cameras will not be installed in communities with a perceived speed problem, i.e. the data confirms that less than 50% of traffic exceeds the national police threshold. As you can imagine, as we only have funding for 7 additional sites going forward, it will be important that we target the most impact at the sites suffering the most from the speeding. However, we will then, as it says in the report, look to move these sites after reviewing them on a 2-yearly basis. As with previous traffic calming programmes, it is anticipated that members will get many requests for cameras to be installed, as was submitted by Councillor Richards as attached in the order paper. If agreed today, we will develop for members and our communities appropriate communications about how sites can be nominated for consideration, the criteria for how sites will be selected, and how we will work with those communities to deliver not only speed cameras but other initiatives. This will also include, then go out to members, but will also include the over 100 sites we've already had nominations for, and how we will be taking those forward so members can check. So once we have developed these communications, we will be contacting all members about this process, and so then we can then go out to our communities, who I'm sure will be very interested in this initiative. With a programme of sites, we were looking to develop those by spring 2021 for implementation of the traffic calming measures in the first instance, whilst procuring the addition of the kit for 7 new sites, and we'll then be looking to install those once we've evaluated the impact of those traffic calming measures we've installed. It should be noted we will need to continue to work through the existing Leicestershire and Rutland Road Safety Partnership, as it is only through that body with the police that the management and enforcement of speeding can be done via the average speed cameras. Finally, we will continue to lobby the Treasury on behalf of the County Council regarding the reinvestment of revenue generated from speeding offences into the Community Speed Initiative and advise members of the outcome of that activity. Thank you, Leader. I'm happy to take any questions. The recommendations are as per the report.
Thank you, and I can imagine they're going to be super popular. I mean, every single village I represent has been badgering me for speed cameras for years. I mean, I represent about 7 villages, so I can imagine you'll get hundreds. Can I first go to Trevor, who's responsible for this?
Thank you, Leader. I really do have to say that our response at the County Council is, of course, in response to our constituents and our local members who have said that speeding is a real problem. And it's, for us, the public safety priority. And we have found the extra money, and we are putting that money into the 7 sites with all the kit in conjunction with the safety partnership. The Deputy Director has outlined it very succinctly and very well. I'm not going to over-egg it, but I am going to say that I'm delighted that we're able to do this, as evidenced by the fact that we've already, off the trial, I think had 15,000 plus warnings and notices issued to motorists. I think that speaks for itself, and there is evidence that this really does keep the speeds down. With that, Leader, I have much pleasure in moving the recommendation.
Thank you, Trevor. Blake?
Yeah, thanks, Leader. Naturally, I have no problem with formally seconding the recommendations on the Green Order paper. I had the privilege, as the previous lead member for the department, of bringing the pilot into play into Leicestershire, and I know how popular the pilot's been. I just want to draw out a couple of the points that have been made by Ian. We know how popular and we know what sort of demand there's going to be for community speed enforcement, and it's down to the ingenuity and the innovation of the department that we're able to find a legal hook to bring the pilots into play in the first instance. Let's not forget that the police play a hugely important role in community speed issues, not least that they're the only ones empowered to take enforcement action and manage the processes behind the scenes. So the fact that we're making a commitment right now, not only to continue our interest within community speed enforcement, but even expand it is a credit, I think, to the County Council. The second point I wish to make is about the lobbying of government. It really is essential that the government actually listen to what we've got to say here. We're trying to do good by the people of Leicestershire. We know there's huge demand and this is a popular scheme, but we can only afford to continue to do this if we've got the capital and the resources to be able to expand the scheme. There is precedent in terms of keeping penalty fares locally, for instance, on parking enforcement, which enables the authorities then to use that money for the greater good of our communities. So although we're using our own capital monies, we'll continue to lobby government to hopefully get them to see that by changing or at least tweaking the rules to allow us to keep some of the monies here locally, we can further expand this scheme to the benefit of Leicestershire communities that are blighted by speeding. Thank you.
Thank you, Blake. I say, Byron, Blake just mentioned money, so we've obviously found 600,000 of our own money. Do you want to just comment on how you're getting on with the Treasury?
The Treasury?
Well, they're the ones that control the money.
Well, in general terms, not particularly well. They are still keeping us very short, as you know. But anyway, we have found the money from our resources for this one. What they have not done, of course, is allowed us to keep the proceeds of the fine income, which is, of course, something which we would have liked to have done, and then we could expand the scheme much more and in accordance with what people in Leicestershire really want. But there we are. We have to keep trying, and we'll do the best we can.
I mean, actually, we were even more reasonable than that with them. All we said was, when I went down to see the minister, was we would like them to have let us have our capital monies back so we can continue to roll out the scheme. We weren't ever seeking to make it a profit centre. We weren't ever seeking to penalise motorists. All we were seeking to do is recoup the 600,000 so we could then give other areas, and as Ian's already alluded to, we've so far got 120 odd applicants for only 7 sites. If the government was a bit more flexible, it would enable us to roll out more sites over a period of years, wouldn't it?
Indeed it would. I have to say, you get the feeling that they're not on our side.
Yes. Okay, so it was moved by Trevor and seconded by Blake. I think we're all in favour of it. We'd just like to do more for the villages and the communities we represent if we could. So can we have a show of hands? Thank you very much. Let's move on then to agenda item 9. Government proposals to reform local government exit pay. This is a report from the Director of Corporate Resources, concerns the government proposals to reform local government exit pay and the likely impact on staff over 55 years of age who are members of the local government pension scheme. We've got Gordon McFarlane with us today, Assistant Director of Corporate Resources. He'll present, then I shall go to Byron. So hopefully you're there, Gordon.
I am, Chair, thank you. If I just take you briefly through this fairly short report, we felt it was important to just alert Cabinet to some of the proposed changes that the Government are seeking to make. There's a number of proposals which are detailed in the report that are being consulted on at the moment, and that, as you said, will impact on staff aged over 55 who are members of the local government pension scheme. So there've been a number of proposals over the last few years, but the latest proposals will have a significant impact on staff across a number of grades, and those staff who leave the council's employment through compulsory or voluntary redundancy via settlement agreement. So there's a range of ways that people could be impacted. So it's important that the council and the pension fund respond separately to the government consultation. So the consultation exercise closes on the 9th of November, and it's the original proposals were to put a 95,000 cap on the total value of an exit package. And there are a range of further measures which are being consulted on, which are detailed in paragraphs 14 to 18 of the report. I don't propose to go through those in detail because they're hopefully set out quite clearly. And it's just worth noting that there's no other parts of the public sector apart from local government who have any live proposals for these further measures at the moment. So local government is the only area that's being impacted in this way. So paragraph 13 talks about the 95,000 cap, and that calculation does include pension strain, which is the cost of paying a full pension early, this cost to the council rather than the cost to the individual. That's now been through the parliamentary process and will be effective from the 4th of November. So that's the first stage of that change. And then, as I say, paragraphs 14 to 18 outline a range of other changes to calculations and other limitations to total exit packages. Those, we don't know when those will come into play yet. They'll be after the end of the consultation period. And probably just worth noting that the focus of the consultation is rather than on the individual items is more around impact and mitigation. So the intention seems to be to bring these changes in, but then look at what mitigation and perhaps transitional arrangements need to be put into place, and we'll respond on that basis. And then I think the final thing to say is that the local government pension scheme regulations will need to change to enable, schemes to pay differently to how they do now. So we've got a number of changes that are coming up that haven't been put in place yet. And I think that's probably all I need to say about the report.
Thank you. Personally, I find this a bit spiteful and vindictive on just local government. If they were doing it to their own civil servants, it would be more fair. But just to single us out, in my view, seems a bit spiteful. But Byron will tell me it is or it isn't.
Well, Leader, it is in fact very mean. The original proposals to limit severance pay to 95,000 cap, I think, had widespread public support because of quite grotesque amounts of money that were given to certain individuals in the past. But now it's been extended, and the regulations will mean this has an impact on people's pensions, right the way down to grade 10, which are fairly modest levels of salary. If depending on how old they are and how close to retirement they are when they actually leave. So it's not good at all. We'll have to adjust our regulations and rules to make the best of it if the government go through with it. But in the meantime, we can make representations. So the Employment Committee will consider this in a week or two's time. So will the Pensions Board, and I think the Pensions Committee as well. But the proposal is to allow the Chief Executive in consultation with the Director of Resources to put together the Council's response, and I'm happy to propose that motion, which is on the order paper.
Yes. Is there any opportunity to insert the word spiteful into the motion, Byron, or not?
I would rather you didn't. I think that might be too provocative.
All right. Thank you, Byron, for that advice. Richard?
Yes, Chairman, I will second that.
Okay, so it looks to me pretty much like we're stuck with it, even though we don't particularly agree with it. So all in favour? Thank you. Let's go on to the next one then. 10, exception to contract procedure rules for direct award of a construction contract, pages 125 to 128. This is again from the Director of Corporate Resources, concerns a contract recently awarded for the refurbishment of the former Oakfield school site. Whilst valid and awarded properly, did not follow the Council's usual process. John Bennett, Head of Strategic Property, is going to explain it, and then Byron's going to speak. Are you there, John?
I am indeed, Leader. Thank you. Yes, as the Leader just said, pages 125 to 128 of your order papers refer to the build contract to refurbish the former Oakfield School on Hospital Lane in Blaby. The school's currently being refurbished to provide a 50-place social, emotional and mental health needs school. And last year, the Council's Project Management Office concluded that the works contract should be awarded by way of a direct award and not a call-off from the minor works framework. Subsequent advice was that an exception report should have been requested at the time. The purpose of this report is merely to regularise the situation in accordance with advice from contract commissioning and legal colleagues. The build contract is still valid. The recommendation is that the Cabinet notes the contents of the report. Thank you.
Byron?
Yes, clearly there's a procedural error here. It was completely unintentional, but no harm's been done because the intention of the measure is perfectly correct, and had it gone through the right procedures, it would have been approved anyway. So I move the recommendation, which is to put right the error and to make the decision valid.
Thank you. Richard?
Yes, Chairman, I will certainly second that. Thank you.
All in favour? Thank you. Agenda item 11, items referred from Overview scrutiny, there are none. Agenda item 12, urgent items, there are none. So thank you very much for attending, apart from Mike Sands.
I was going to say, Leader.
Yes?
Can I just add, Mike has said that he is travelling into County Hall for 4 o'clock for the all-member briefing due to his technical failure in Nottinghamshire.
Ah, that'll help you out then, won't it, Lee? Because you're doing the 4 o'clock briefing. Okay, thank you very much. See you later.